All right. Well, good morning, folks. I know my teammate Laura has been letting folks in from the waiting room, and it's good to have all of you on for this morning and our town hall. It's been a while since we've um, had one of these town halls featuring our dean. So we're going to actually go ahead and kick things off. I think we had a good number of folks who were in the waiting room, and I'll do a quick introduction and go through some housekeeping items. But several of you, I know most of you who are on the line today, but if we haven't met, my name is Pam Lowe. I'm the Senior Director of Development at the School of Nursing, and really pleased to have our Dean Jean Giddens on today to share some updates about the school, all the things that are going on during the spring semester. And just a couple of housekeeping items, though, before I hand things over to her. We are recording today's town hall so we can share that with others. Just wanted to make you all aware of that. And at the end of the presentation, if there are folks who want to ask questions, you are more than welcome to include those in the chat, or you could private message me if you would like to do so, if you'd prefer to ask a question in that way. But there will be some time for some questions after Dean Giddens' presentation. And I also wanted to do a quick introduction. I'm not sure who all maybe can see my teammates who are on the screen. I'm spotlighted right now, but if you can see Catherine Stein, she's our scholarship and stewardship specialist, and she handles our scholarship process, coordinates with our scholarship recipients, and manages stewardship activities for the school. And then also Laura Keller, she's our alumni engagement coordinator and helped to really spearhead and get this event together today. She handles all of our alumni events and communications with alums. So that's my teammates who are on the call today. And right now I'd like to hand things over to our Dean, Jean Giddens, who's going to give some updates on the school and all things that are going on. Jean, I'm going to hand things over to you.
All right. Well, good morning, everyone. And thanks for that introduction, Pam. And thanks to my really wonderful development staff who not only have helped put this together and advertise it, but also just everything that they do to help our school. As you know, I'm the Dean at the School of Nursing here, Jean Giddens, and believe it or not, I've been here now almost 10 years. So I don't know where the time has gone, but boy, it has really flown. So Laura, you can go ahead and advance the slide. To start off, I'd like to remind everyone, you can go ahead to one more, remind everyone that we have reunion weekend coming up April 21st through 23rd. And so we'll be celebrating all alums, especially those in the 3 to 8 years, and as well as the class of 1973 as they celebrate their 50th reunion. We'll drop a message in the chat so you can know how to register. It looks like it's just popped in there, so that's perfect. I also want to make sure that everybody uses the chat if you wish to communicate with folks during the presentation, or if you want to put a question in as I'm talking, we'll see that. And if we don't see it while we're talking, we'll certainly come back to any questions that get posed at the end of the presentation. All righty, well, let's move on then to the next slide, which I'll be introducing some of our new leaders at the School of Nursing. So first up, we have Michelle Edmonds. Michelle joined us last fall. She's our Associate Dean for the undergraduate program and the department chair. And she came from Southside Community College as the Dean of the Health programs down there. So she's been with us, like I said, since fall, is really learning quite a bit about the difference between community college environments and the, four-year universities. But leadership is leadership. She was a very effective leader in the community college system and is settling in beautifully here at our school. The next leader I'd like to introduce is really not a new leader, but a leader who has changed her position. So Terry Jones is our new program director of graduate practice program. She's replacing Shelley Smith, who departed in December. Terry's been with us several years now in a faculty role and has been the concentration coordinator for our nursing leadership program. So she has stepped into this role and is really being very, very effective. She's also leading our curriculum development work with NetForce, which I'll tell you about a little bit later. And then another person that I'd like to introduce in a leadership role is Joe DiRanieri. Joe is now our director of the Langston Center. So our director previously was Michael Bly, and Michael retired, and I'll just use air quotes, he retired. I don't think the man will ever retire, but he retired from VCU, and we needed to find a new person. We did a year-long search for this position and did not come up with any external candidates that we wanted to move forward with. Meanwhile, Joe was already on our faculty and he agreed to step in and serve as interim, and then later we went ahead and placed him in as the full director, and he's going to do a great job. So this is really an opportunity for Joe. And then the last person I want to introduce is Stephen Davis. He's a DNP, and he is our interim associate dean for diversity, equity, inclusion. He's actually in a shared position with the College of Health Professions. So he's the interim associate dean for diversity, equity, inclusion in both schools, and has January, as we've had one of our other associate dean, Angela, medical leave. So we've really enjoyed getting to know Stefan. Is actually, I said Stephen and it's Stefan, so I apologize, but he's not here, but I should pronounce his name correctly. Let's see, the next slide, we'll move into academic program updates. So one of the areas that we've been making steady progress in is the diversification of our student body. We need to have more diversity in our healthcare workforce, and we've taken that very seriously. So we have adopted a more contemporary process for our admissions, and we have right now about half of our students self-identify as non-white, which is really pretty amazing considering the somewhat relative lack of diversity that we saw in a lot of our nursing programs a decade ago. So our school is proud to graduate the largest and the most diverse group of students in our pre-licensure programs in the state. So we're very pleased about that. Next, I'd like to share with you a little bit about enrollment updates. So in January this year, we expanded our traditional BS program to 130 students. So that represents 15% increase in the number of students that we admitted in that cohort. So like many other programs, we're doing everything that we can to help support the workforce shortage. And so one obvious solution is to admit more students. It's not that easy though, because we don't have enough faculty to admit all the students who apply for positions, and we don't have clinical placements to place all the students who apply for our programs. But we did make a commitment with a 1-year head start to expand clinical sites. We've hired more adjunct faculty, and we did go ahead and bring in a larger group this year. So our faculty have been very positive about the process of taking in additional students, and our clinical partners have been fabulous about helping us get placements for those students. And then a second initiative that we started this last year is an academic coach. We created the position in our school. I believe it's been a full year now, and Lindsay Tierney, Dr. Lindsay Tierney, is our inaugural hire for the role. And her role, she provides academic support, she provides study tips, test taking advice, troubleshooting, a lot of personal challenges that these students have, connects them with resources on main campus. And our intent here is that they have a neutral person. So Lindsay is not a nursing faculty member. She's a doctorally prepared individual with higher education background. So she's a neutral person for the students to be able to engage with, and she's able then to help them troubleshoot. And so the intent here is that they don't drop out of school when there are some things that maybe Lindsay can help them with. So far, they have been very welcoming to her, and we have seen a real uptick in the last semester with her presence here. And we're really excited to have her with us. Next, we're going to talk about rankings. And U.S. News and World Report, as you probably are aware, puts out annual rankings on all sorts of things, including nursing schools. So we are very, very proud to have several of our programs ranked very highly. The undergraduate program is ranked number 22. And when you think about the, I don't know how many hundreds, probably 1,000 nursing schools in the or more that would apply for U.S. rankings, U.S. News and World rankings, we're number 22. That puts us in the top 4% of all undergraduate nursing schools, which is pretty fabulous, quite honestly. Our online master's program, we have 2 categories that rank high. The Nursing Administrative Leadership program is ranked 11th, and overall best online masters were ranked 21st in the country. And then our masters, and the distinction between these two, one is the online master's program, and then the other is just in general the master's program, and that's ranked 34th in the country. And our D&P program is ranked 35th, which is actually pretty incredible considering we've only had our D&P program not even yet 10 years. So it's still a relatively new program. Next, we're going to talk about a couple of students. So we like to try to feature some students so you can kind of get a good sense of what our students are like and who some of our students are. So the first student I'd like to tell you about is Teresa Lacey. And Teresa always knew she wanted to be a nurse. Her grandmother was in her 40s when she gave birth to Lacey's mother. As a result, her grandmother was older when she was born and was already experiencing health problems. As a young girl, Lacey often assisted her grandmother with her medical care. She would help her grandmother sort her pills, manage her diabetes, and her grandmother would call her a little nurse. These experiences inspired her to go into healthcare. Lacey was originally from Mississippi. She earned her undergraduate degree in nursing from Norfolk State University. And throughout her 21-year nursing career, she has held a variety of positions. But she returned to school and completed her master's degree in nursing with a concentration in nursing leadership and organizational science this past December. She currently works in clinical implementation manager, and she is looking forward to taking on greater areas in nursing leadership. The second student I'd like to introduce you to is Jasmine Blanco Vargas. She's on your right. She's an undergraduate student with the class of 2024, and she provides an opportunity to connect with patients to make a real difference through empathy. Outside of classes and clinicals, she makes time to give back as the secretary of Collective Corazon, a student organization with a mission to provide health equity in Latinx and Hispanic populations and break down cultural barriers that prevent Latinx communities from receiving the same health services access to healthcare that other populations enjoy. And she states, I want healthcare professionals to realize everything it took for the patient even to get to the doctor's office, let alone what goes on during the visit. The patient most likely had to take time off from work, which is money for their family needs to be there. And then they have to deal with the embarrassment and frustration that comes along with language barriers. And culturally, there's a lack of trust toward the health system. So for them to seek help in such a vulnerable state is a feat in and of itself. And she really does speak from lived experience. And I will tell you, I've had a couple conversations with this young lady, and the passion is real. So we're very, very proud of both of these students. And again, this is just a sampling of the kind of students that we have here at the VCU School of Nursing. Next, we're going to talk about, I have my paper out of order here. Apologize for that. Here we go. We're going to talk about research, scholarship, and community engagement. Now, this last fall, we had several of our faculty pictured here become fellows in the American Academy of Nursing. And these are Dr. Pretzer Aboff on the far left. You've already met Stefan Davis in the middle, and of course, Terry Jones on the far right. So their induction last fall brings the total number of fellows, American Academy fellows among our faculty to 12. And I'll tell you, it's quite an accomplishment to become a fellow in the American Academy of Nursing. So having 12 of our faculty as fellows is really quite an accomplishment and speaks volumes to the quality of the faculty that we have here at the school. Next, I'd like to share a little bit about the research portfolio that we have, and really the strides that we have had in the last few years in research. It has been a trajectory that has just continued to grow, and the blue bars in the one graph show you the total funding that we've had, both federal and non-federal, over the last few years. And although 2023 isn't done yet, we expect to be over $6 million at the end of this fiscal year. So how have we been able to get all these awards? It's really been, number one, getting the right research dean with us, and secondly, having the Office of Research staff provide such incredible support to our faculty who are conducting the research. So we have really expanded the level of support in our pre-award process, our post-award management process. We've got support for them to manage their grants. We've got support for them for writing grants. So it's just a really incredible influx of funds. And of course, with more research funds, the benefit isn't just how many dollars come in. It's also an attraction for doctoral students. So one of the things that students who want to earn a PhD look for in a school is a school with an active portfolio and somebody who's conducting research that looks like them. And sure enough, with this increase in funding, we're seeing an uptick in our PhD students. So we've really just got an incredible number of students engaged with us now. And again, this year so far, we expect we're going to be at about maybe 6.3 by the end of the year. Last year we were at 7. So really back to back 2 really incredible years, and we don't see any evidence that this is going to slow down anytime soon. Next, I'd like to share a couple of the specific grants that we have that have been driving this research funding. Probably the largest grant that we've had in the whole whole school history is this Recover study. So Amy Salisbury and Patricia Kinzer are involved in this NIH funded project looking at long COVID, specifically in infants, children, and adolescents. Now, the reason I say this is such a large study is because this is one piece of a very large $470 million study by the NIH. And what they've done is they've got multiple sites for this study, and VCU School of Nursing is one of those sites. So it's a very complex study. It's going to be over a number of years. We are recruiting a lot of students and children into this study, and it's a double-edged sword with studies like this. It's great to get these in, and then it's complex to manage them. So Dr. Salisbury and Dr. Kinzer are really busy right now managing this project. A second project I'd like to share is a project that is being led by Dr. Jane Chung. She's the second from the left there. She's got a project that is involving smart speakers with older population, specifically how you can support independent learning and wellness among low-income senior housing residents. The smart speaker technology gives reminders for social activities in the facility, safety risk notifications, or even medication reminders. And I watch my mother, and she's always trying to remember to take her meds. And I can just imagine that having a smart speaker to remind you at noon you need to take your blood pressure pill. I think it's really a great idea. The team is also evaluating attitudes, perceptions of residents toward their voice-operated smart speaker. And we'll see what those results look like as we get further into that study. Next, we have one more to share with you, and this is the community of care. Really, it's the Richmond Health and Wellness Program. You have heard about this over the last 10 years. Richmond Health and Wellness is in its 10th year now. When I first arrived here as a dean, it was a brand new project that Pam Parsons had received a HRSA grant for. And here we are 10 years later, and not only is this program still going, but they've gotten another large grant, and a $4 million HRSA grant to expand Richmond Health and Wellness into the community. So this grant is going to support what they're calling the mobile health and wellness expansion, and it's going to be involved in 4 communities: Alberta, Tappahannock, Petersburg, and Southside Richmond. The reason that they're calling it the mobile health and wellness clinic, and the reason they're able to reach these 4 rural areas, is they're in the process of buying a van, and the van will go out to these rural communities with nurse practitioners and students, and they will be in these different sites 1 day a week. So we're really excited about this. It is a great opportunity, not only for our students to learn in these rural communities, but it's a great service that we're able to provide access to wellness services for these vulnerable populations in these communities. So next, I'd like to talk a little bit about some of the key initiatives that are going on in our school this year. We are undertaking a curriculum redesign, and this curriculum redesign is something that all the schools across the country are working on. In 2021, the American Association of Colleges of Nursing adopted the new essentials. So these are the new education standards for nursing education. And so it's called Core Competencies for Professional Nursing Education. And in order for us to fully implement the new essentials, it's really requiring a total curriculum redesign. How are we going to do this? Well, the school has formed an Essentials Implementation Task Force, and you might hear people talk about NETFORCE, NETFORCE, and it stands for Nursing Education Task Force. Anyway, it comprises of faculty who teach undergraduate and graduate programs, and the goal is to completely redesign the curriculum for the master's, the bachelor's, and the DNP programs by September 2023. Well, we're already in March 2023, and September's not that far away, but they've been working on this for about a year now, and we'll get the curriculum submitted to the university and then goes through the state approval process, hopefully with the opportunity to start offering the new curriculum in school year 24-25. The biggest changes that this new set of standards represents is the transition to a competency-based education and the creation of a new 2-level nursing education model. So it's going to require a more intentional assessment of the knowledge, skills, and abilities of our students. And our faculty will be spending a lot of time not only doing the curriculum redesign, but retooling themselves so they learn how to do competency-based assessment. And hopefully the intent here with this curriculum redesign and the new standards is to elevate the practice readiness of our graduating students across the country. Next, I would like to talk about our faculty practice expansion. You might recall that last year we started for the first time in the School of Nursing a formal faculty practice, and we are kind of finishing, we're guessing in the year 18 months, we're finishing year 2, but in year 2, we adopted or expanded the practice to include 3 more faculty members. And then this summer, we expect we will be adding 3 more. So 3 in year 1, 6 in year 2, hopefully 9 in year 3. What we're really being able to do is just gradually build this practice up. So what this practice means is that our nurse practitioner faculty are able to practice as nurse practitioners at the VCU health system as part of their job. It's not a joint appointment. It's literally they are practicing as faculty, and the health system is buying their time out and providing the practice sites for them. This is a really important milestone for us because it's hard to recruit nurse practitioner faculty because of the requirements for practice that they must maintain. So by having a practice opportunity as part of their work plan as a faculty member prevents them from having to get a part-time job on their own time on weekends or evenings in order to get their practice hours. So we have seen a much easier time recruiting nurse practitioner faculty to the School of Nursing since we've adopted this model. The other benefit is that we are placing our nurse practitioner students in practice with these faculty. In other words, these faculty are not only in practice, but they are directly mentoring their own students. So by having first 3, then 6, and hopefully soon 9 faculty practicing, that's a lot of clinical placements that we have picked up. And anybody who has any awareness of nurse practitioner clinical placements will tell you that those are really hard to place. It's hard placing students in general, but particularly nurse practitioner students. So we're really excited about the continued expansion. Dr. Pam Parsons was behind helping us getting it established. Dr. Lana Sargent is our assistant dean for faculty practice and community engagement. And she is really at this point leading the faculty practice expansion. So more to come on that, but it's really one of the greatest things that we've been able to accomplish since I've been here. I'm really proud of where we are with this. Let's see. Next, we're going to talk about our new chief nurse. Many of you might recall that Deborah Zimmerman stepped down from her role in 2021. And in the fall of 2022, we welcomed Tina Mamone, our new chief nursing officer. She's been with us now a few months. I actually had lunch with her yesterday, and she's at the 6-month period and still getting her head around the health system. But she is going to prove to be just a wonderful partner, and the benefit of having somebody that we can connect with on such an easy basis is we depend on the health system for our academic delivery, and the health system depends on us for workforce. So we really are needing to be attached at the hip, and it's so much easier to be attached at the hip when you've got a partnership with the health system that is so strong. So she's just really wonderful. So she's the one in the dark hair there, second from the right. The last thing I thought I might mention is the engaging lectureship series that we've been able to offer, and we've had several. So we have something called the School of Nursing Lectureship Series, and what this program does is allows us to bring in experts in a variety of areas to do presentations, and they may be presentations to our students. Oftentimes they're presentations to our faculty, and these lectureship series are actually sponsored by the endowment funds that we've had over the years from a variety of people to support either lectureships or faculty development. So some of the topics that we have had recently include health equity in action. This was a presentation by Dr. Camille Burnett. We had innovative approaches to support maternal, child, and family health development and equitable care. This was a presentation by Julia Basso, Brittany Howell, and Jacqueline Nanenzo. We had another presentation called Simple Disruptive Technologies and Health Equity Innovation. It was a presentation by Wendy Henderson. She is a senior researcher at University of Connecticut. And we had a presentation just recently, Truth Reckoning, Reconciliation, Nursing's Past, Present, and Future. This was just last week or the week before for Black History Month. Presentation by Katie Boston Larry. She's the director of nursing programs at the American Nurses Association. And I'll tell you, she was absolutely fabulous. So the next slide, I think, might be, oh yes, fundraising. Wow, what a year we're having. Let me just say that. I think this year we are going to raise more than what the entire goal was for the last campaign for the School of. That should really tell you a lot. Last year, we had 577 donors, made contributions of 3.9 million. So we're talking about last year, okay, last fiscal year, to support nursing in fiscal year 2022. We are in the School of Nursing. I should also mention we have the highest faculty and staff participation percentage at VCU for the VCU Employee Giving Day. So we're really, really pleased to always be at the top. I think every year that they've had participation percentages at the university, we are always among the top, and last year we were the top. This year, we are having our biggest fundraising year on record. And I don't remember exactly where we are, but I think, and Pam can probably clarify this, but I think we should be able to hit 15 million this year. We're on track to have a $15 million year, which is absolutely amazing. Is that we have a $15 million year going on, or was it 16 million? Maybe that's what I thought, is because we've had a very large gift from the Conways. And the next slide introduce us to this transformative gift, 13 million from Joanne and Bill Conway. We're going to have the ability to provide to over 1,000 nursing students need-based scholarships, and primarily targeting our undergraduate and doctoral nursing students. So between this gift plus all of the other gifts that we have from other foundations and our donor base is so generous for scholarships. We have just a tremendous amount of scholarship support for the students. I bet we have probably more scholarships than any other school I can think of, really. It's that amazing. So this is one of the best ways that we can possibly support our students. And by the way, I should mention that our students have a very high need. So it's probably written on my script, but I've lost my page count here, but a very high percent of our students, it probably says here, but it doesn't matter. We have a high number of students with need. So I think that gets us to the end of our presentation. And I think at this point, we've got plenty of time for just general discussion and questions.
Yeah, thanks, Jean. And I think Laura, at this point, or Catherine, if you were going to remove the slide maybe, or show who else on our little squares. There we go. Yeah, no, I appreciate being able to hear from our dean. I know all of you probably appreciate the updates as well, hearing new information. And you are correct, Jean. So we've raised just over 15 million, and we will head towards the $16 million mark as we prepare to book a couple of additional gifts that came in. And I will also just add, I will add from a scholarship perspective, and knowing several of the folks here who were on our call today who support scholarships and know that that's an important part of what you support is just as Jean said, we do have a lot of support for our students. It certainly does not cover 100% of our students' needs. So we really appreciate all the gifts that we receive.
Yeah.
So this all said, I would like to, there was a question that had come into me, and so I just wanted to make sure that I posed that question, and then certainly allow folks who are on the call today to ask any additional questions that might have cropped up. So one question here is wanting to know what course deals with helping students combating misinformation and disinformation with their patients? And if you can just explain a little bit about that, Jean.
Yeah, that's a great question. And I'll just say, I wish we had a magic wand to stop the misinformation in general in this society. But I think as long as we have people using social media the way we do, we're kind of going to be in for ongoing challenges. But, you know, one of the things that is a central piece of our educational model is patient education and patient-centered care. So it's not a matter of there's one course that we teach misinformation. It's a matter of in all of our courses as students interface with students, we're reinforcing best practices in patient education. And part of that is making sure that our patients know the kind of websites to find accurate information. And quite honestly, we have to teach our students too. What are the best places to find accurate medical information? And also then being aware of the health literacy issue, because there's a lot of information out there that might be accurate, but the patients don't have the literacy, the ability to understand what they're reading. So this is just an ongoing, probably every clinical course, we're reinforcing how to best provide educational materials for our students and for our patients.
All right, Jean. Well, I appreciate you answering that. And from here, just wanted to see if anybody else would like to take themselves off of mute and have any comments or any questions for the good of the cause. Y'all are quiet. Okay, well, and you know, Jean, nobody, there weren't other questions for us to address that had come up anyway during the town hall. So I just wanted you to know that. All right, well, if there aren't any other questions for the good of the cause, just a quick note that my teammate Laura, she always sends out just a really short survey. If you wouldn't mind checking your email and answering that later on, that just helps us to understand what you appreciated about today's program or any future programming that we may want to put on for you all. And hopefully we'll see some of you at reunion. Laura's also very hard at work at that. Putting all of our details in place and getting ready for a fun weekend in a few weeks. So looking forward to, actually, this will be our first time to kind of go back to what we were doing before the pandemic, and that's being able to host some programs within the School of Nursing. So looking forward to being able to do that. Anything else? Did I forget anything, Laura? Did I forget anything, Catherine? All righty. Everybody, thanks for joining in today. Really appreciate it very, very much. You all have a good rest of your week and take care, okay?